Nanchong Central Hospital. Abortion Health Education. First, what is induced abortion? Abortion is a termination of pregnancies which is unplanned or due to any serious diseases and other reasons. Abortion has certain impact on a woman's health. To do a good contraception to either avoid or reduce the risk of unwanted pregnancies is the main purpose of family planning. The medical termination of pregnancies of unwanted abortions has two methods. It's either medical abortion or the surgical abortion. Let's see about the indications of abortions. The terminations of pregnancy should be within 10 weeks of pregnancy without any contraindication. Continuing any pregnancies with some serious disease is not recommended. Whereas the contraindications for abortions are having any genital tract inflammations, acute phase of various diseases, cannot tolerate the surgery, and the body temperature preoperatively being 37 degrees Celsius or above. So now let's talk about the precautions of abortion. There are few points, and the first point is you need to take a shower and change your underwear the night before the surgery and maintain a personal hygiene. The second one is you're supposed to bring your own sanitary napkin, wear a loose trousers and bring the paper towels. The third one is for a painless surgery, it is recommended to fast 8 hours before surgery and stop drinking water 6 hours before surgery. And the fourth point is no fluid or a food intake 2 hours after the surgery, and it is recommended for all the patients to take 1 week of rest, which is going to be appropriate. Out of bed activities can help in the uterine hematoma discharge, is conducive for the uterine recovery. Usually, weak body, poor physique and lots of blood loss can be appropriate to increase the rest time. 5. The diet. It is not recommended to have a spicy food, cold and a raw meat. Avoid irritant foods, avoid alcohol, tobacco. Concentrate more on the nutritious foods, include more of proteins and vitamins. The easily digestible foods like the fruits, vegetables, the lean meat, milk, egg or the soy products. Sixth point is on the day of operation, it is recommended to take shower and also maintain the genitalia clean and sanitary. Often change the menstrual towel. Due to the new trauma to the uterus and also the vaginal bleeding, retrograde infections are prone. And prohibited sex within 6 months after the surgery. The seventh one, post-operative prevention of infection, 5 to 7 days. 7 to 10 days after the surgery, please come to a gynecological outpatient for the review of ultrasound. 8. Slight abdominal pain and a small amount of vaginal bleeding which is less than the menstrual cycle within 2 weeks is absolutely okay. If the patient feels more abdominal pain and if the bleeding is more than the menstrual bleeding and exceeds more than 15 days and accompanied by any vaginal foul smelling discharge, abdominal pain or cramps or any discomfort, please return back to the hospital. The ninth point to be considered is usually the menstruation returns to normal after 1 month after the surgery, but usually a delay of 17 to 15 days is considered to be okay. If the patient has not got her menstruation after 15 days feeling any discomfort, abdominal pain or anal distension, please revisit the doctor. 10. To avoid the repeated abortions and to protect the reproductive health, it is recommended to have a contraception for 3 to 6 months under the guidance of doctor to help repair the endometrium. It is also recommended to have a happy mode to increase the postpartum recovery. The 11th, follow an outpatient doctor's advice and seek a medical attention if you're feeling unwell outside an hospital. Finally, the 12th point is do not drive on the day of general anesthesia abortion. Thank you.